I'm here with Dr Mark Manford, consultant neurologist from Addenbrooke's and Bedford Hospitals. Welcome, Dr Manford. Can you tell me what you think the future of epilepsy treatment is, please?
Well, I think that talking about the future, one should perhaps spend a moment talking about the past. And there's been an awful lot of new drug development, which has been very useful in some ways in reducing the side effects that some of our patients have been exposed to, but not been as useful as we would have wished in terms of getting rid of their seizures. So I'm very hopeful that the new research looking into not just controlling seizures, but the way that epilepsy develops will be useful, what are called anti-epileptogenic drugs. And here at the conference there have been some interesting presentations looking at that side of things that I hope will produce results not in the near term, but within a few years.
Okay, and what do you think the challenges are facing people with epilepsy today?
Well, the challenges for most people with epilepsy are social, I think. First of all, overcoming their own fears in relation to their illness. Secondly, overcoming the fears of people around them, which restricts their lives a lot. There are, of course, the medical aspects that they face, the complications of the condition, and so forth, that we would hope to be able to try and treat. But for a condition where people are normal 99.9% of the time and only suffering from an illness very occasionally, it has an amazingly substantial social disability.
What other sessions have you seen at the Congress that have interested you?
Well, there's a whole range that I've been to from surgery for epilepsy and looking at choosing patients who might benefit from epilepsy surgery and looking at outcomes, all the way to looking at representations of epilepsy in film, which is always interesting and I think reflects that slightly skewed perspective that people have, and as the point was made in that presentation, is often to do with dramatising epilepsy in a way that is not always very favourable to patients.
Okay, how do you think that epilepsy services in England and the UK generally compare to services around the world?
Well, we have very few neurologists compared to most of the rest of the world, so that's a bad starting point. So that means that where epilepsy can be looked after by specialists in epilepsy in many places, we rely on more generalists to look after the bulk of epilepsy, and it's only the few patients that actually see an epilepsy specialist. We have epilepsy specialist nurses, which is not available everywhere, and I think that is a fantastic link providing support for patients in the community. And I think the care of patients with a long-term medical condition should be mostly in the community. So I think we do some things well and some things less well.
Okay, I'm going to ask you some questions specifically to do with England now and the NHS reforms that are happening at the moment. What are your views? I mean, what are the challenges of NHS reforms?
Well, I think that there are two ideas that are often muddled here. The first is NHS cuts and the second is NHS reforms, and they're both happening at the same time. The NHS cuts, like cuts in any organisation, are difficult, and I think that's difficult for healthcare staff and it's difficult for the services they provide as well. Overall, so far in my part of the world, services have held out, and I think that quality has not been compromised and that there has just been an improvement in efficiency so far. But new developments in services are noticeably more difficult than they were 5 years ago. So in terms of the reforms, the commissioning reforms, the place of neurology in those reforms isn't yet clear, because you might know that there are two ways in which services are going to be commissioned. One is locally and the other is nationally. And the document that came out a week or two ago kind of says neurology is a bit of a mixture of both, and we don't quite know where epilepsy will sit with that. But I think that the idea that clinicians in hospital will talk to clinicians in the community in commissioning and services is an advance. So I think there are some positive things there.
Excellent. Okay. Should trusts continually review their services, do you feel?
Well, we should always review what we're doing and try and improve it. There's always room for improvement, yeah.
And why is it so important for somebody with epilepsy to be diagnosed and treated quickly?
I think that, again, it's the social consequences of that diagnosis. Being stopped from driving has a major impact on many people. Some will lose their jobs. Getting that right so that people who don't have epilepsy don't suffer that, and that people who have epilepsy start treatment as quickly as possible in order to get their lives back together. And of course, helping educate them about the condition, educating their families and their employers so that they can be in a more tolerant environment and not suffer those kind of social injustices that they currently suffer.
Do you feel there are any benefits for people with epilepsy to be treated in the community as opposed to the hospital?
I think hospitals should only be used to treat conditions where the person actually has to be in a hospital, and the majority of care of a chronic condition should be in the community. But that's not to say that there shouldn't be the appropriate expertise in the community.
And finally, do you feel that people with epilepsy should be involved, should understand their condition and be involved in their treatment?
Absolutely. I mean, we're here to provide support to get a person's life back to normal, and they need to be able to tell us what normal is for them, and they need to be able to understand what we are trying to do and engage in that process. Otherwise, it's doomed to failure.
Dr Manford, it's been great talking to you. Thank you very much.
Thank you.